Okay, okay. Well, happy, wonderful Wednesday, everyone. I do not take it lightly that you took the time to come on. And one, I should be able to have this recording so people who aren't able to join can see it. And I am excited to see the people that are saying where they're joining in from. Johnny from Chesapeake, Virginia. Shirley from Alabama. Shirley, Alabama. I'm in Alabama too. Late in Alabama. Awesome. No, I'm in Huntsville. I'm near Huntsville. And I already said New Mexico was in the house. So you're definitely in the right place. I'm gonna tell you why you're in the right place. Because if you are someone who said there has got to be something else. I mean, this whole metabolic health issue, what is that? If these are questions that you had running around in your head, you know you're not feeling the best, and there has to be something, a reason why you're feeling that way. We're gonna talk about that. We're literally gonna spill the tea. So I'm Dr. Tiffany Marie. I am a real medical doctor. I don't just play one on social media. I am a real one. I went to medical school and I actually did family medicine for 20 years, did private practice, urgent care, telemedicine, and I kept seeing the same stuff. I kept seeing people needing medicines for diabetes, blood pressure, cholesterol. I kept having people have heart attacks or amputations. I kept having people coming in to see me and they swore something was wrong with them, but their labs were normal. And so none of that was adding up. In medical school, I was so gun ho about being able to help people take back control of their health. I like saw me as a superhero. This is what I was going to do with my life. And after 20 years of practicing, I realized things start to look differently. Medicine start to look different. We had algorithms defining when you start a medication, when you increase the medication, when you add another medication. We had rules on how insurances were going to reimburse us for all the work we did. And over time, that wore me out. And I no longer thought practicing medicine was fun. So I looked at something called lifestyle medicine. I had a colleague who was talking about it, and I said, "Okay, what is that? Is that something you just made up? It kind of sounds like woo-woo medicine. Like, what is this? Is this what naturopath? I mean, that's not the same thing. What is this?" And so it's actually a real specialty, but you see that specialty in more progressive areas, California, New York. You see more of these places that are actually doing these different specialties, and it's about going after the root causes of conditions. So instead of, hey, you have high blood pressure, here's a medicine for that. Oh, and now you have diabetes. Here's a medicine for that. How about let's get to the root? The root is your lifestyle. And not just because you've been making all bad decisions all the time. No. Well, some people have. You know, we have some real people that know they've been doing some stuff. But sometimes it's our environment. It's how we were raised. It's what we thought was healthy because providers like myself and maybe even Wendy told you was healthy, but it wasn't. And we had to learn more. And once you know better, you do better. And so here I am doing better. I started getting on social media talking about all these lifestyle changes you can do. But I found one thing that was holding my members up, my patients up, and it was consistency. It was having something that made them be able to be sustain these changes. And they needed some help doing that. They needed some coaching. They needed some education. And once I came across these plant-based tools, it became a no-brainer. And so now I get on this call every Wednesday with my friend Dr. Esther. And for those that know her, she is enjoying and living her best life. So it's just one sister doc spilling the tea tonight. But I have two amazing guests that are going to give us two different perspectives of where they were before they started tackling and taking back control of their health. And then we're going to also talk about the root cause of this stuff, insulin resistance, and the natural products I love, which is why we're here, right? So if you're in here on this call and this is your first time, I'd love for you to put that this is your first time. We'd love to see you. And then I'm going to make sure that my Lutrecia, Miss Lutrecia,
Yes.
make sure you are ready. Uh-oh.
Can you
So
hear
we're gonna
me?
look at sideways. Well, I hear you. Okay. So the sideways thing didn't work for you.
Didn't
I
work.
tried. I tried. Okay. Well, so Latricia has a wonderful story. This is a professional lady. This is somebody that she wasn't going to be she wasn't going to be won over quickly. It took us a little minute to try to get her to really pay attention to this, but I'm
Indeed.
glad we did. I'm glad we did because she has an amazing story to tell. So come on up and I'm gonna shut up and let you have the stage, lady.
Okay, thank you so much for having me on. So my story is interesting. It started
Uh-oh.
probably a year ago. Can you hear me, Dr. Tiffany?
We hear we hear you, but for some reason I can't see you anymore.
Oh, well, I'm here.
Oh,
I can
no.
I can see her.
No, you can see her. The problem was I pinned the wrong person. Go ahead.
Okay, again, this is gonna be good. So my story really started about a year ago. My sister Myra was telling me about this system that you could take, and it's gonna help with all your little ailments. And I'm a Capricorn, I ain't believe none of that. So, long story short, I deal with multiple sclerosis, dealing with fatigue, inflammation, just tired all the time, no energy. So, Dr. Tiffany and Myra finally just kind of hemmed me up and talked to me about the benefits of at least trying it for at least 3 months. So I decided, you know what? I'm going to try it and I'm going to do right for at least 3 months because I was on it, but I was just doing the unicity. I wasn't doing everything together. So I did right. I tried it for 3 months. Well, in those 3 months, literally, y'all, 3 months tops, I started having energy, I'm a banker, started having energy, clarity. Really noticed it when I went on vacation with a friend. They kept saying, well, can we stop for a minute? I was like, no, we got to do so and so. And I realized I wasn't tired. So I was telling Myra about it, and she said, it's because you've been drinking your teas. And I was like, biggest issue. I had an A1C scare. So I already deal with multiple sclerosis. I didn't want to have diabetes and multiple sclerosis. Went to the doctor, did my labs. My doctor literally gave me a fist bump. He said, Lutrecia, whatever you're doing, you keep doing it. In 3 months, when we see your labs, if you keep trending, which I know you are, I'll see you every 6 months instead of every three. And I told him, thanks a lot. But I'm talking about inflammation gone, clarity's back, energy galore. Just do right, y'all. All I got to say. Any questions for me? I mean, it
Wait, wait,
works.
wait. First of all, I need you not to spin on through that. Okay,
Mm.
let's really talk about MS. So, and the reason why
Ugh.
I'm saying this because my mom has MS. So some people
Okay.
don't know what this is. This is an autoimmune condition where you're attacking the brain. So, if you don't mind sharing some of those symptoms that you've been struggling with that condition, like the fatigue is a little different than I'm just tired today,
Oh
right?
no. The fatigue is there's no amount of rest in the world that you can get. You can sleep all day and you still feel like you haven't been to sleep. Heat, really, like if you go out in the sun, it's like kryptonite. That's how I use it. Kryptonite. I've been to the beach. In fact, I'm going to the beach again. I couldn't do the beach. Before, when I did the beach, I had to wait until nighttime. Now I'm at the beach, laying out, reading books, and it's just been what 4 months tops that I've been on
Hmm.
this product. So
Yeah.
yeah,
Yeah, yeah, it's like a whole different animal. Like when it's summertime, my mother can't do anything. And she's 74, and it would literally shut her down. Now because she's been drinking the products, she can actually work through stuff and is sometimes beating me doing things.
exactly.
And and then one of her biggest issues was dragging her foot because that's where her lesions were on her brain with this condition. And now she's been able to not do that as much too. So we're literally trying to improve inflammation, and we realize that's in the gut. And so when we do that, autoimmune conditions like this get better. So I am so excited to hear what's been happening with you.
Yes.
The fatigue is a much bigger picture. That's why I had to break it down because
Oh
everybody,
yes.
this isn't that perimenopausal fatigue or that I ain't getting enough sleep
No,
fatigue. This is that malaise, lay in the bed, I'm not going to get up, do nothing
I
fatigue.
can't get up.
Yeah,
Literally, I'm
yeah.
washing clothes. I'm doing the garden. I'm going to the beach. I'm traveling. I'm going to collect grandkids every weekend. They keep me walking and active.
Mm-hmm. Yes, 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 yes. Now you say A1C scare. What was that number? Do you know?
It was a 6.3,
Okay. And what
and
was the
now it's
repeat?
and now I'm down to a 6.0. It went down 3 points
Oh, and
in
you said 4 months.
3 months.
3 months. Okay. I
Yes,
love that. That
in
went
three
from
months
knocking on type of diabetes door to
to getting
pre-diabetes, trying
back
to
to
be
where I need to be, to trending in the right direction.
in the
Yes,
right direction. Yes,
with
yes,
no other medication. I'm not on
yes,
anything.
yes. And what's
Yep.
good to understand, there's a process. So not everybody overnight ends up dropping their sugars significantly overnight. our bodies are smart enough to know what to attack. So some people are going to deal with your awful fatigue, your MS inflammation
Yes.
first. And then we see the sugars coming down. I love this. Thanks so much, Lutrecia, for sharing. I appreciate you coming
You
on
are,
here.
you are welcome. I have more for y'all the next time, but baby, that was enough for me. I got energy. I can do stuff.
I love that. That's the quality of life thing. So you
Yes.
really find out what is important for me. When you
Yes.
start looking at this stuff, you say, what is going to make me excited about using these products? What's going to make my life so much better? Sometimes we have Keith on calls
Being
who
able to
talks
get
about,
out of bed.
yes, or being able to
Being
run around
able
with your
to focus
grandchildren.
at work.
Yep, yep,
Yes.
that is perfect. Well, thank you so much.
Thank you.
So you're welcome. And what we're going to do now is we're going to talk about why we're even on here. So yes, we've heard Lutrecia's MS story, which is wonderful, and I can't wait to hear how the rest of this plays out. And for my people that understand, sometimes don't understand, sometimes insulin resistance is going to take 6 to 12 months to fully clear out. We're not talking about something magical because your body has been dealing with this stuff for decades, most of us. So if we think
Mhm.
it overnight, something's going to be perfect, I'm just going to fix that for you. That ain't happening. I tell you one thing you may get overnight is some energy. I mean, I got
Yes.
my energy the first couple days. Okay. You may even have some inches and some weight loss too. But to fix everything overnight, no, we need to have some real expectations. So I want you guys with me on that. But let's talk about what is happening here. Why we are feeling the way we are feeling. And I like to title this Beyond the A1C. Uh-oh. Okay, finally. Beyond the A1C. And so a lot of times what we think of when we say A1C, we're thinking of sugar, we're thinking of type 2 diabetes. Am I right?
Mhm.
We're not thinking of blood pressure or cholesterol or MS. But I know we look at A1C, but our body's trying to tell us something way before that A1C comes up. And unfortunately, your doctor doesn't know this. Your doctor's trained to wait till the A1C comes up. But if you're having that stubborn weight around the midsection, yeah, that's insulin resistance. Um, it's not just the insulin shots and the sugar, okay, or diabetes or prediabetes for that matter. Now, when we have how this starts out, most of us start with a healthy, normal metabolism, okay? And then insulin resistance is silent. It starts to grow, rising, basically a lot to do with how we're eating and what we're eating, okay? But when those symptoms begin, like energy crashes and cravings, that's the telltale sign. And that usually starts to happen 10 to 15 years before the A1C starts to even get elevated. Your blood pressure starts to get elevated because when your insulin is high, your insulin actually makes your kidneys hold on to sodium. And if I take you back to chemistry class, water follows sodium, so it's going to increase blood volume. Okay. But that high insulin also damages the inner lining of your blood vessels. And so now it's not a smooth lining for that blood to flow. So that blood is going to be pushed harder to make it through those vessels. That's increasing blood pressure. The volume and the fact that the lumen of those vessels, the inside of those vessels are not smooth, right? That's increased blood pressure right there. Then it makes your liver actually make more LDL, decrease HDL, make more triglycerides. There goes your high cholesterol and triglycerides. And then eventually over time, you end up starting having problems with the sugar and diabetes.
Mhm.
And so because I don't like talking too clinical, let's look at the symptoms. The afternoon fatigue, the afternoon crashes. I actually used to get at that 2 p.m. crash, and I know I'm not by myself. I was living on those monster drinks, Those 5 hour energies, I think the only time I took a break from those is when I was pregnant. Okay. That was the only time. But I wouldn't have made it through medical school, residency from taking care of my patients without something. That's what I believed. Because if I didn't have it, I would be hangry in the afternoon. Or that brain fog walking into the room thinking, oh my gosh, what did I forget? I'm supposed to be doing something, right? I know that happens to my people on here, and it's not just perimenopause. No, most of the time, this is insulin resistance, the stubborn belly fat. You're on the treadmill doing all the exercise, cutting your calories, and the weight's not coming off like it did when we were in your 20s. It's not. It was so much easier in my 20s. You know why? Because I didn't develop all this insulin resistance. The coffee dependence, the poor sleep, okay? All those things are telltale signs that you are actually dealing with something. Now, I like to ask this question, especially when I do a live. And just like we said, what is this one symptom you would love to get rid of? Is it the fatigue? Are you having that lay in the bed, can't get up and go anywhere fatigue? Is it really just the weight? But I like to look past the weight because my question is, if you weren't paying attention to weight, what is the real symptom that you want to get taken care of?
Mhm.
Is it the blood pressure? Is it the fatigue? Is it the brain fog? Okay, is it the sleep? Because all those things matter for your quality of life. Now, I call this the whisper wheel because I believe that insulin resistance starts way before you start to have actual diagnoses to explain how you feel. I believe your body's whispering to you with the sugar cravings, the constant hunger, the skin tags, because when insulin is high, it acts like a growth hormone. Now you have skin tags on your neck. Now you have dark patches on your skin, under your arms. Okay, that's not dirt. I'm sure you've seen people and said, that girl has a dirty neck. That girl was probably dealing with insulin resistance, especially if they had a midsection weight. And you guys have seen these things, right? Now, poor sleep, joint pain, inflammation is a good one because I think a lot of people don't realize how inflammation is like insulin resistance ugly twin sister. Because when insulin is high, it stuffs what we eat into the fat cells. That's how you get that belly fat or that fat around your organs, the visceral fat that takes us out of here. And so those fat cells start to release inflammatory markers, cytokines. They release the things that are going to cause inflammation. And then dysbiosis, that's when your gut isn't acting like it should and it's leaky and things are seeping out of your gut. That's increasing inflammation. On top of the fact that when you start seeping stuff out your gut, what happens? Now your body's trying to attack this stuff that's coming out your gut that's not supposed to be there. You're breaking down food, you're trying to make stool, and it's sliding out of your gut. Now your body's trying to attack that too. Your immune system is becoming weak and it starts to attack you. That's how you get things like these autoimmune conditions, things like the MS, things like the Hashimoto's. That's when your thyroid gland is being attacked by you. Things like Crohn's and ulcerative colitis and lupus and rheumatoid arthritis. Okay. Now, joint pain is just inflammation, period. And yeah, all related to insulin resistance. Low testosterone, because that insulin actually affects our hormones. So the men affects the testosterone. And then right behind that is that erectile dysfunction. Though that would be that doorknob question I would get from my males when I be leaving the room. Are you sure it's nothing else, Mr. Johnson? Well, by the way, Dr. Tiffany, things aren't getting up like they used to. That is a real issue. And how about all we had to do was address the lifestyle, what they were putting in their body, how they were eating, when they were eating, fatty liver, polycystic ovarian syndrome, I mean, heart disease, all these things that we think, okay, no, this is stuff that I may have to take a medication for forever. No, actually, no. We have the science and the data to prove that's not true at all. But unfortunately, a lot of times people go to see their provider and they feel dismissed, they feel not heard. They go with the complaints from that whisper wheel and they get their labs done, and the A1C and the cholesterol is called normal. Nobody's looking at an insulin resistance ratio dividing the triglycerides by the HDL because those two numbers can be normal and that ratio still be elevated at 2 or 3. And that actually is indicative of insulin resistance. But if you aren't looking at it, you aren't going to see it. Nobody's checking the fasting insulin. You know why I know? Because we weren't taught to do that. Now you have some doctors now that are learning because one, you know better, you do better. But most of the time your labs are not going to have those things on there. So you'll go, your numbers look okay, but you feel like crud. And that's because it hasn't been found yet. And so why we do these calls is we want to make sure that you guys understand you're not alone, you're not crazy. What you're experiencing is real. Okay. And so here's a little cute little graphic talking about how the healthy cell normally responds to insulin. So when cells are healthy, they actually listen to insulin. Insulin is needed to bring the glucose into the cell. So when you eat, your carbohydrates, some of the fat gets broken down into, well, actually, some of the protein gets broken down into glucose. Okay. That glucose is one of the two energy sources for the cell. Insulin determines which one you're going to use, if you're going to use glucose or fat. So, but insulin is needed to get glucose into the cells. Without the insulin, that glucose does not go into the cells to be used. Okay. So, in a normal, healthy cell, you respond to insulin just fine. Insulin doing its job. The glucose is getting to the cells. Everything's going wonderfully. Okay. It unlocks the door. But if you are constantly eating
$80 for these.
Now,
so I'm annoyed, but it's kind of comical.
So,
I got 2 rows of hair extensions.
My co-host, I need you guys on your job, finding who that is and muting them. Okay. And so if you're constantly eating carbohydrates and eating that every couple hours, and some of that's because you were told to do that, because that's what the old food pyramid told us to do. We had to snack. We had to eat 6 to 11 servings of carbohydrates. How are we gonna get them in if we're not snacking? That's a lot of carbohydrates, right? Well, carbohydrates are your biggest macronutrient that gets broken down into a lot of glucose. So if you're eating that frequently, that's going to flood your body with a lot of glucose, making your insulin have to do a lot of working, making your pancreas have to do a lot of working. And in the beginning, your pancreas keeps firing and firing and firing to try to get as much insulin as it can to force that glucose into the cell. But over time, the cells stop listening and the cells become resistant. Now, insulin resistance is two things: the cells not listening to insulin anymore, and insulin being too high in the bloodstream, which is how it causes all those other issues: the PCOS, the kidney trouble, the heart disease, the blood pressure, the cholesterol. That high insulin is behind a lot of those other issues. And then we see menopause. And so I know I have ladies on the call. One of the things that would happen a lot is you would go to the doctor with all those whisper real complaints. The mood changes, the fatigue, the weight gain around the midsection, all these things. And you would think, oh, it must just be menopause. Oh, it must just be perimenopause. But I will tell you, insulin resistance, when we start tackling that, those perimenopausal symptoms have gotten better for me and so many other women, because during this perimenopausal period, your estrogen is dropping, and estrogen made our cells more insulin sensitive, made them respond to insulin better. So when it's not in there like it should, what happens around perimenopause is it's fluctuating. You start to become insulin resistant, and that's why those symptoms kind of look like the same. And so many of us, once we start dealing with that, the poor sleep, the darkened skin, the skin tags, the even the regular menstrual cycles, because of the hormone fluctuations, actually improve with a lot of us. So it's not just the hormones. Now, there are times when insulin resistance is normal, and that's pregnancy, because you're growing a whole human in your belly. And then puberty, again, because you're growing a whole human, you, right? But if it starts to last longer, that's when we need to be concerned. And this is why the A1C doesn't tell the whole story. So the A1C is really only helpful when it's, the pre-diabetes or diabetes range. It's only helpful because of the data we have. At those places, we know to give this particular medicine. And when I say we, I mean providers. We know to give metformin or insulin or Janumet. We know to give those medications when it's in the pre-diabetes range, which starts at 5.7. And then the type 2 diabetes, which starts at 6.4 and above. Okay. But unfortunately, your cardiovascular health, heart disease risk, stroke risk, is actually getting worse starting at an A1C of 5. So the goal, we want that A1C to be less than 5. But nobody's paying attention to that, because 5 would be called normal, right? That's why you have people that have heart attacks, and you're like, they were so healthy. No, they weren't healthy. Just nobody knew how to find what the problem was, or to tell them what the problem was. So I'm here to tell you, insulin resistance is reversible, 100%. That's the tea. That's what I'm spilling. You do not have to be on medications forever. You do not. I absolutely don't believe that. Now, there is a place for medications, so I don't need anybody saying, this doctor saying you don't have to take medications, because it's not what I'm saying. I'm saying that if we actually adjust our lifestyle, I'm seeing people get off of their medications or not need them at all. And so that's nutrition, that's quality sleep, that's healthy relationships. Social interactions are huge. You can't just be living all by yourself and living on the island and think that's going to be good for your health. It's not. Resistance training, muscles, stress management is huge, because when stress is high, you're releasing cortisol. And cortisol makes you release glucose, because the whole point of stress is the fight or flight, right? Or what's the other one? Or you stand still. Well, nobody wants to stand still when you come across stress. That's useless. Okay. But if you're sitting at your job all day, mad at your boss because you're stressed, right? The whole point of that was to get us to run away from the bear. We needed the energy to run. But if you're just sitting there mad and complaining and talking to your coworkers, what you think your glucose is doing? It's just rising. It's rising, increasing insulin, and putting us in this awful, nasty cycle. So yeah, you got to manage your stress. And you got to avoid harmful substances. Alcohol makes the stress response worse, makes the weight gain around your midsection worse, which is that visceral fat. That takes us out of here. So if changing your lifestyle were easy and you can just up and do this tomorrow, everyone would already be healthy. The problem is life happens, cravings happen, stress happens, work happens, hormones change. And sometimes we literally just need support because sometimes it's hard to make these changes and stay on that consistently forever. That's when you have a group of people with you that make it easier. That's one thing we do provide with what we do is we have a group that we actually get together, do calls like this, do larger calls, because thousands of people, I mean, we've even had a million people that have actually started to use the Feel Great products. And so we're able to help so many people, but we're doing that together. And we have the tools to make these changes easier. And so I like to say lifestyle changes are like doing a fist fight. Yeah, you can fight somebody with your fist. You guys are both fighting with your fists. But who doesn't want to level up? Who doesn't want to be able to pick up a brick or bring a knife to the fist fight and shut it down? I want to shut it down. When I'm struggling with diabetes and blood pressure and cholesterol and this weight gain around my midsection, and I'm fatigued and I'm tired and I'm miserable, I want to shut it down. And that's what these tools are doing for people. And so great thing is we have real results from real people. And we're going to hear another testimony from Wendy Knox. But your body isn't broken. It's communicating. The question is, are you going to take the time to listen? Or are you going to keep sitting there acting like you don't hear it whispering? Because it is. It's talking to you. So Wendy, I would love for you to tell us one with your medical background. Because I know you have some of the same things that I've experienced. And it's touched you in a way too, to where you're on these calls like this.
Right.
I want you to share where you were in your health when you decided maybe this is something I want to look at, and then share what you noticed, and even share with your results with other people that you've been able to help.
Okay. Thank you for having me on tonight. I titled my little bit of spill here, Hormone Hell, because that's where I was at 3 years ago, really. And it might even make me tear up talking about it, because the truth is I had suffered for about 30 years, not knowing that there was something that I could do for myself. But I started suffering as a teenager. And as a teenager, I just thought it was bad luck that I had a 7 to 10 day cycle. That started early on for me. And I just didn't know what to do, and nobody helped me with that, right? That's been a very long time ago, and nobody knew what to do. And I didn't know my body was giving me clues over all these years. I started as a late teen, all the way into my 30s and 40s. And by 49, I was absolutely miserable, thinking this is not how I'm going to go into my 50th year of life, right? There is no way God is going to want me to suffer more years than I've already suffered. So I was just dealing with one health issue after another. And really, I just kept thinking, that's not that bad. That's not that bad. Heavy 7 to 10 day cycles, iron deficiency anemia, panic attacks caused by iron deficiency anemia, migraine headaches, Hashimoto's and hypothyroid disease, endometriosis, all of the things. And I'm going to condense this for tonight and not even talk about my my gastrointestinal issues, because I had a lot of those too. But I'm going to keep it at these hormone issues here, because it's a lot. But the hardest part is that every symptom that I had, I went to a different doctor for. And no doctor ever fixed any of my problems. I was handed a medication. I was given an iron infusion. I was offered an ablation or a hysterectomy or all of the things, medications for the migraines that were menstrual cycle associated. But nobody ever said, hey, Wendy, you have estrogen dominance, or that insulin resistance is playing a role, your gut health is playing a role in these things. And I suffered for a very long time with all of that, taking a different medication or 2 or 3 from each doctor and trying to live life and get by, because I worked, and at the time I wasn't in healthcare. So I wasn't in healthcare until the early 2000s. So Had no idea about any of those things. But every doctor was just looking at one piece of my problem, and nobody ever looked at me as a whole. And even after I became a nurse and became a nurse practitioner, I didn't look at myself as a whole either. I didn't know that iron deficiency anemia could be caused by this, this, and this. And I didn't know that estrogen dominance was playing a big role in endometriosis and all these things, right? Or insulin resistance was driving all of that. I don't blame doctors because, doctors are working for a corporation and then they get about 5 or 6 minutes with you at a time. And I helped build their schedules back in the late 1990s. So I knew what their schedules were like because that's what I did before I became a nurse. But years later, when I started learning about metabolic health as a nurse practitioner, because of my own health 3 years ago, my own health crisis of being so sick and so fatigued and in so much pain that I took 5 months off unpaid in 2022 and 2023 that because I couldn't function very well. And then I just happened to find out about this protocol and I was really about to pay $7,000 to a thyroid hormone specialist because I thought for 1 year I was going to pay her because I thought my thyroid was killing me when in fact what I learned was I was actually killing my thyroid. So actually the inflammation from my Hashimoto's that I knew nothing about until I tested myself, all these years my inflammation was actually driving my Hashimoto's to attack my thyroid, and I was actually killing my thyroid myself, and did not know that. So when I learned that and started making changes towards that, now I had cut out gluten, I had cut out dairy, I had done the anti-inflammatory diet, the Atkins diet, the cabbage soup diet, the Weight Watchers, the Jenny Craig. I'd done all those diets over the years just to try to get rid of inflammation in my body. But none of that ever worked. And why didn't that ever work? Because I didn't know anything about insulin resistance. I didn't know what really having true gut health really meant. And when those two things happened, it changed everything. So, my knowing why my body was struggling and changing those things, that's how I got to where I am today. But that happened 3 years ago. This month actually is when I started the protocol. So it's been 3 years in August that I started. And what did it do for me? I lost 29 pounds and I've kept that off. I have energy that I have never had in my entire life. When I tell you that I suffered with 3 diagnosed autoimmune diseases, and I feel like probably at least one other autoimmune disease that I just refused to get diagnosed with because I knew I wouldn't take the medicine. I just had a lot of chronic fatigue, a lot of chronic pain, joint pain, abdominal pain, endometrial pain, C-section pain, hip injections that I was getting at 42 years old. My sleep changed, my migraines went away, my psoriasis cleared up, and I had psoriatic arthritis. Cravings went away, and I just brain fog. I would see patients and do visits, and I would have to do everything sitting in the room with them because I couldn't remember anything when I walked out of the room. But 3 months into this protocol, I could go in, see my patient, do all the stuff, walk out the door and chart everything and remember it all. And that was very quick. I mean, that happened within a short time frame from the brain fog I'd been living in for 15 years. And I mean a lot of brain fog. So, it really changed my whole quality of life. I feel like, and I tell people this all the time, I was given a new lease on life. And, it's sad that we suffer that long. I feel really ashamed. Like you said, we don't know what we don't know until we know it. So, now that we're trying to help people really fix the root cause of their problems because we've done it for ourselves. But I feel really ashamed that for years I was not able to do that for people and that I just gave them the injections and I gave them the insulin and the GLP-1s and all of the blood pressure medicines. When 3 medicines didn't work, we added 2 more, and things like that. Well, if 3 medicines aren't working, the chances are adding 2 more is probably not going to fix the root cause either. We're just giving you more side effects. So, if we could fix, as women especially, if we could fix our insulin resistance and gut health before we hit the menopause transition time, we could prevent this huge collision that takes place because insulin resistance worsens menopause, and menopause worsens insulin resistance. And that's when a lot of women end up with the high cholesterol, and they end up, their doctors don't talk anything about their menopause symptoms or the fact that their liver's just not working well anymore, and that insulin resistance has caused this, and gut health. But if we could fix those problems before, that is my goal now for people. I want to fix it if you're there, but I want to fix women's insulin resistance before we hit that menopause transition, because why should we suffer? So for me, at 49 years old, 3 years ago, I really thought, I actually asked God, how could you let me suffer all these years? And now in this menopause transition time, it's even worse, right? I would get dizzy, have the hot sweats, be standing in a room with a patient and have to just stop. And, knowing the patient's like, is this woman on something? Is she on drinking alcohol? Is she on drugs? And it was dizziness and all those things we have in menopause. But all of that stuff went away, completely went away. 3 to 6 months into this protocol, my life was a different life. And I want to offer that to people. I want to help people do that, because I think that as a healthcare system as a whole, we have really cheated people out of a lot of years of health and good quality of life. And my hormones from day one as a teenager, I was actually discharged from the military for iron deficiency anemia, because I passed out a lot. And they didn't try to get to the root cause. They just said, oh, well, you're not good enough. You can't do this. And I was crushed. So, I just wish somebody had helped me sooner, and that I just didn't get sent to a bunch of different doctors. And, Dr. Tiffany, I know you see this, and I see this every day still, because I see patients. Everybody's got 3 or 4 or 5 different doctors, and that's sad.
It is. It is.
One,
I mean, I
one
think,
root cause for the most part.
yeah, yeah.
These are
Well, I mean,
not
that
separate
was,
diseases.
you gotta love this. This is what happens when you are so excited about getting your life back. People can't get you to stop talking.
You
You will be
can't.
talking forever, forever, forever. Thank you
Absolutely.
so much, Wendy. I love your story, and I know we
You're
only got a
welcome.
piece of it, because you need to have, you know what? You just need to be doing this. I need to be a guest on your live next time. That's what needs to happen. Okay. And so if anybody's been hearing these stories from both of these women, I had no idea this was going to be like an autoimmune Zoom today. So I am loving
Right?
where that went. Definitely put in the comments on if this is something that actually you didn't realize. And you said, oh my goodness, that is great to hear that people that are dealing with these issues are getting better. And so at this point, I'm sure people are like, well, what are we talking about? What is it that people are actually getting better with? What are they doing? Oh, yeah, yeah, yeah. What are they doing? And so I'm sure at this point, that's what everybody wants to know. And I am going to tell you, but I want to pull up something to show you. There it is. You know what? I gotta stop. I gotta have a better game face. The problem is I'd be showing too much on my face. People tell me that all the time. Okay. So real people with real results, what are we talking about? We're talking about really some simple products. And some of this I'm going to actually kind of fly through, because we've talked about this. We've talked about what insulin resistance is. Someone's trying to take over my screen. We talked about what insulin resistance is and the signs that people struggle with. We talked about that. None of those symptoms should be new to you at this point. We talked about the whispering wheel, I like to call it. None of that should be new at this point. Now, the modern diet dilemma, this was that part of me saying, not all of this was your fault. If you were told to eat every couple hours because your sugar would drop, a lot of times that's what I used to tell my patients. Well, you need to snack because you got to fuel your body. And what does that do? That sets you up to this eating every couple hours, and you're usually grabbing carbohydrates. And so that's going to make that glucose higher, and that's your insulin higher. And now, besides the fact that our foods have changed, years ago, we didn't have the same types of foods. We have so much processed foods out there that have more processed sugar in there that kick up your glucose significantly faster. Okay, the rice has been changed. We've moved out the fiber. Now we're not eating the apples. We're drinking the apple juice. Okay, so what do? Wendy actually gave a good point on this. And one day I may just want to have her back to talk about the gut issues, but we got to start with getting our gut healthy again. And so the great thing is we have a product that actually increases the good bacteria in the gut. We have studies that it does this. 7-strand fiber blend with a multivitamin in it, okay? And it's a patented blend. This is not your Metamucil. This is not your Benefiber. And it's been studied by the University of Sydney and the Cleveland Clinic. Okay, this is the institution that does heart disease studies, okay? And when this balance was studied, which is the fiber blend, what it found was if you take it consistently, it can even potentially decrease the need for cholesterol-lowering medications. Now, if you hear me say that, that should make you be excited because the leading prescribed drug in the US is a statin, a cholesterol medication, with a long list of side effects. So you have so many people that don't want to take that because of that. And so we have an alternative that doesn't have any of those crazy side effects. And then you have the yerba mate extract drink. And why is this great? This has a huge amount of chlorogenic acid. And this is not your normal yerba mate that you can see in Walmart. No, this is a patented blend. They get the leaves from Argentina. We know exactly where it's coming from. They have a 5-step purification process. Okay, this is not just something you can just mix on your own in a cup. I'm sorry, it's not. But with the packets we have, you can actually pour it into water. You don't have to create it from the tree. No, that's already done. You just add the powder to water. And what the studies have shown is that when you actually use this yerba mate, you can actually increase your GLP-1 by 60 to 70%, 67% exactly. Now, GLP-1 is made from the gut. So hence why the first step of this was healing your gut. Okay, so most of the times our gut is not healed. I mean, it's not healthy. That's why we're in the state that we're in. So when we build up the good bacteria, we're able to build more GLP-1. When we're actually using the yerba mate, we can produce it even more, especially when we're fasting. And it helps with energy. So that's part of that whole energy and mood. It has theobromine in it. That's that feel-good part of chocolate. Oh, my kids have said I was in my hippie state as soon as I started using these products. They were like, I don't know who this new mama is. This is not the high type A personality mom we used to know. This is just somebody different. Yeah, you're right. I'm like living my best life and enjoying it. But not only that, let me tap on this too. The gut, 80% of your serotonin, the hormone that is behind anxiety and depression, comes from your gut. So when we start healing our gut, mood gets better. I mean, I was able to get off of my antidepressants on top of my blood pressure medicine, on top of losing weight around my midsection. I mean, I thought I was cute before. So play with me now. I'm just playing. This is what happens when I'm on 10. Okay, how we do these products? Okay, we do these products very easily. You wake up in the morning and start drinking that unimate drink. That's that yerba mate extract drink. You start sipping on it because you're trying to mimic that GLP-1 get in your bloodstream, almost like an IV drip. Okay, you're doing that for 3 or 4 hours. Lots of us skip breakfast because that's the easiest meal to skip without looking like a weirdo. If you have a family, skipping dinner, you kind of look like a weirdo. Your daughters are looking at you like, what? You're not eating anymore? Is that an eating disorder? Everybody's woke now. You can't just do stuff like that. So, but actually skipping dinner would be better. That's a whole nother conversation. But most of us skip breakfast. And so when lunch comes, we actually use a balance. That's that fiber blend. It coats your food. It decreases how much carbohydrates and cholesterol gets into your bloodstream. And so this is helpful for my people that haven't been able to say no yet. One, the yerba mate turns off that food and carbohydrate noise, but my people that are still overeating some, this makes it harder to overeat, but it also gives you some grace. It decreases the carbohydrates and the carbohydrates and cholesterol that gets in your bloodstream. And so some of us use that balance with our lunch, if that's our carb heavy meal, or we use it before dinner. Okay. Then after lunch, we start that unimate again and sip on that again, because that's when we're doing fat burning, because we aren't snacking at those times. So now our body is in fat burning mode. Once we get insulin down, your body starts to burn fat, and that's where we want it to go and get the fat out of the organs. Now, we have a few testimonials here too. No gout, A1C from 13.8 to 5.9, down 89 pounds. My friend Elena, was able to get her cholesterol to 76 points. Down 100 points. Actually, down her triglycerides down 120 points is what that says. No sleep apnea, off of all her medications. Down 50 pounds, A1C from 7.9 to 5.4. Do you guys see this stuff? I hope they get you excited like it does me. That's why I do this, and that's why I do this with the energy I do, because this is something I was not able to see practicing medicine for 20 years, as much as I told my patients. So I am loving this. Lost 63 pounds, no longer pre-diabetic, inflammation gone, joint pain gone, okay, skin clearing up. That's the stuff we're talking about. And so when we talk about, okay, so this is great. You're telling me about all this stuff, this magic thing. We're not saying it's magic. It amplifies the lifestyle changes. And the cost, because I know that's the next question, is about $5 to $6 a day. And so when you think about that, you're skipping breakfast, So you're skipping a meal. Even if you don't skip breakfast, you're going to skip a meal. You're not going to snack as much. Odds are you're probably going to save money or this be cost neutral like the rest of us. And then the other thing I like to say too is, you should be worth that. Are you worth $5 or $6 a day? If you can have less joint pain, if you can have less fatigue, if you can have less bloating, if you can get off of those medications that you go to your doctor for to get, if you can decrease the risk of having to be put in the ICU for your type 2 diabetes being out of control, is it worth $5 to $6 a day? Those are the things I ask people because that's a simple question for me. So, I did pretty good. Got some time to spare. So since I do, I'm gonna bring my ladies back to see if anybody wants to have any question for our guests who were able to share their stories. Oh, do the camera one. Okay, I got you. So if you have any guests for my ladies that were on tonight, this is the time. Or me. So this is the time. I'll give you a couple minutes to put some stuff in. So I mean, come on, ladies. I mean, I hear the energy. You guys are just as excited as I am. This is what you do. When you love what you do, you just can't not be excited about it.
I go out to see patients now, and I saw 6 patients today, and every patient's on all the medications, right? All of them. And I occasionally will find one that's very receptive of my conversation and very happy about it. And so I always talk to them about it. I don't talk about the system just because, it's a work corporation thing and I can't do that. But I do talk to them about insulin resistance and gut health. And I talked to one man and he was so excited about looking up some of the information that I gave him on insulin resistance. And he is suffering with all of the things. And it's really heartbreaking to see that. It just kind of fuels my passion. And then I had one lady tell me today that one of her doctor told her, you just have too much going on. We can't talk about that today. That's what her primary care doctor told her. You have too much going on. And I'm like, isn't that so sad that that's where healthcare is at? So it just breaks my heart to know, that that I used to have to do that to people and I just don't anymore.
Yes. Well, Teresa put in here, she's been suffering since 29 with all the same symptoms Wendy has, and she's 57. Oh, so she was on here for you.
Oh, you're going to get healthy, Teresa. We're going to fix those problems.
Yes. And Anita says, I could have never fasted without this product. And I've been in this for 2 weeks and the food noises have, I missed something, have cut out. Yep, that's about right. I think that's right. I love that. Thanks, Anita. Thanks, Teresa, for putting that in here. Okay, ladies. Lutrecia.
Yes. So Myra asked the question, as someone with MS, what do I find most help with the system? For me, it was really the fatigue and saving money because I don't like taking medicine. I got a drawer full of medication. I can get the script, but I never took it because I don't like taking medicine. So it's saving me money. It's saving me money all the way around. I'm eating 1 or 2 meals a day. I have energy. I'm not on crutches. Every other month I was on a boot or a crutch or couldn't walk, and my clients would say, oh, what happened to your leg? And I'll just say, oh, it's just a childhood injury, because I got so tired of having to explain. So, I mean, I'm living. I'm mobile.
That's amazing, really.
And it's been
I've taken care of so many MS patients that could have used this product over the years.
Yes.
Just truly, just autoimmune disease in general. We just get told it just happens and there's no reason, but there is a reason. And it's because our gut's not healthy and our cells aren't healthy. And when those two things aren't healthy, it just really wreaks havoc on the body. So that inflammation is just.
And then you were talking about those migraines. I don't know what a migraine is.
I'm telling you.
Oh, no, I had them too. And
those migraines left.
Yes, they have left since I've been using the whole system and protocol.
But my doctors always blame that on hormones. They just say it's all it's hormonal.
It's just hormonal. Everything is hormonal, or you're just stressed because you're a mom, or you're stressed because you have kids, or you're stressed because you're working. I enjoy working. I enjoy kids.
Same.
So yeah.
I had a
now stress does play a role. Stress does play a role, y'all. Let's
Oh,
not pretend like it
absolutely.
don't. It
Yeah.
But some
does. It
stresses
does.
are good stresses.
Yeah, absolutely.
Mhm.
What were you saying, Wendy?
I was going to say, I have a 27-year-old patient yesterday, and she told me her primary care doctor told her she was tired because of her kids. And she said,
Oh,
no, it's more than that. Like, this is not just the tired from running around all day. This is a tired where I can't get out of the bed tired. And she's like, they just don't want to listen to me. So I gave her, but I always give good information. But it's sad to hear those things. That just breaks my heart when we just get dismissed so easily. And, you know,
it is. It is very sad. And so that's why it's great to have platforms like this and to have ladies like you sharing what you've had to
Mhm.
deal with because somebody needs to hear that. I mean, Teresa was on here to hear your story. And
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 had I been able to had I known about Hashimoto's years before I did, you know, my thyroid might not have had nodules on it. But by the time I found out I had Hashimoto's, because my doctor never once checked me for that, but by the time I found out, I actually had thyroid nodules that I found on my own as well. But had I fixed the inflammation all those years ago, knowing that was the cause, the driving force of my thyroid problems, I could have fixed that and potentially reversed the thyroid issues that I was having. So I really caused my own hypothyroidism is what happened. But really subsequently I may could have fixed all of that and avoided so many different things. And we just don't educate. And I know doctors don't tell people about or don't talk about Hashimoto's because they say there's no way to treat it. But there is a way to treat it. There is a way to treat it. You
mm-hmm.
get healthy,
It
you
is.
know, you get your cells healthy, you get your gut healthy, and you reduce the inflammation, and that's how you treat it. And, you know, 29 pounds of inflammation gone. I mean, I could talk about this all day long. Absolutely.
And so last question, Lutrecia. If you have somebody, if you know someone who's on the fence and they've been on this call or if they've been on other calls, what would you tell them that you think would be helpful to push them off the fence?
To be honest, I would tell them to stop being hard headed like I was. I did
Mhm.
not believe in it. It takes a lot for me. I mean, I'm one of those people that I have to see, and I could see everybody else's story. 3 months. I would say give it a shot for 3 months, and you'll see the difference in your health, your weight, the way you think, the way your body feels. I just feel good. I get told, "Oh my gosh, you're aging backwards." I love it.
Absolutely. I've heard the same thing. Yes.
You don't look sick. I'm not sick.
That's it. That
I don't
I,
part.
look sick because I'm not sick.
I would say stop wasting your $5 or $6 a day on junk, on things that you don't need. I would go without a car. I would not, if I needed a new car, I would buy a clunker. I would go without new clothes or shoes. And I would definitely go without all the junk foods that we used to buy to have this product. I would sacrifice anything. Absolutely.
Yeah. Yeah.
For
I
it.
mean, and with a 90-day money back guarantee, what do you have to lose?
What do you have to lose? HSA, FSA approved, so you can use that. I mean, I have a lot of people that do. I mean, it's not even cost neutral. You hear people say that. To me, I think it's cost positive. I think
Mm-hmm.
you make money back by not going
Mm-hmm.
to the doctors and not paying out of pocket and not it's cost positive because your long-term health isn't suffering. You
Yeah.
know, if you're it's like going to the farmer's market and buying all the best organic fruits and vegetables and going home and preparing them all week if we had good soil, going home and preparing them all week long. That's what you're drinking that. And really there's nobody out there, probably very few people that are doing that. 7% of Americans maybe, because
Yeah.
they're the healthy ones, right? 93% are unhealthy. So um
So true, so true. We were at the talk we had in Atlanta, and one thing Raph said was he said, remember when it used to rain and you used to see all those worms hanging out, after a rain? You don't see that no more. So that means the soil's not even good enough for the worms. Hold on. I mean, why we think our veggies and our fruits is gonna be good coming from that soil? The worms don't even want it, y'all. The worms don't even want it.
that's
So
right.
at this point, we have to actually put back into our bodies what we need. And what's great is that these products allow us to do that. I couple them with the lifestyle changes and what I tell my people on the fence. You either pay now or pay later. And when I say pay later, being a daughter of a father who died from his third stroke at 50. So a year older than I am, my father died. And basically because he couldn't control his sugars, he can control his blood pressure, he can control his cholesterol. It wasn't the first stroke that didn't help him make a change. The second stroke didn't help him make a change. The third stroke, no, he still didn't make a change, and he didn't have any more options. 3 strikes, you're out. Who wants to leave their family that way? I don't. That's why I do these calls. That's why I started taking these products and working on my health. I don't want to be in a hospital. I don't want to see my family members there. My brother was in the ICU for his second time. And once I saw this, I said, we're not repeating the whole daddy thing. You're going to get yourself together. And that's why we do these calls. It's because we have something we know that is going to help. So imagine yourself walking into your family member's room, seeing them struggling, seeing them with tubes down their throat, tubes in their nose, knowing you were just on a call talking about the things that can help them. What's stopping you from telling them? And then if that could possibly be you in the bed, what is your excuse to not want to try what we're talking about? Because all you got to do is prove us wrong, but you won't. But I thank you all for joining this call. I thank my lovely guests. You guys have been awesome, 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 awesome. And you know what? I'm not going to say thank you because we gave you so much value. I'm glad you're here. And I pray that you actually share this information with someone else because somebody else needs to hear it. And we do this again next Wednesday. You are welcome to come. Same link. Invite somebody else. Thank you, ladies. Thank you so much. I'm glad you all are on this live.
Thank
You guys
you.
have a great
Thank you.
night. Bye-bye.